Hello, my name is Morgan Dill. I'm a Master's of Athletic Training student here at TLU, and today I'm going to be talking to you about my Estim article, which is the contralaterally controlled functional electrical stimulation improves hand dexterity in chronic hemorrhagitis, a randomized trial. So context and background, there were 80 stroke patients that were taken. The only requirement for them was that they needed to have unilateral finger extensor paresis, which basically means that they needed to have a weakness on one side of their hand. Generally, that means that they needed to have decreased grip strength, decreased range of motion, numbness, tingling, things like that. The purpose of this study was to determine whether or not ESTEM, or electrical stimulation, has the ability to increase feeling on the said affected area or increase the range of motion / the strength of the infected area. Methods. So the patients that were taken were required to have moderate to severe hand impairment. Moderate meaning that they had at least 10 degrees of thumb extension and wrist extension, and severe meaning they had less than that. There were 12 weeks of the trial, completely of the treatments. They were assigned to either the CCFES treatment or the CNMES treatment. The CCFES treatment was a treatment that caused electrical stimulation to, over time, adapt and change into a larger grip of the hand based off of the other hand. So if it was starting here and they wanted the goal here, they would bring it out as much as possible to make that and contract here and then come back. The CNMES treatment was just a repetitive treatment from 0 to 250 of the pulse duration in 1 second that caused a large contraction. The surface electrodes were placed over the forearm and the thumb extensors, and people actually did this at home, the patients, and learned how to do it on their own. The results, the outcomes measured in order to find the results were the box and block test, the arm motor abilities test, and the upper extremity Folge-Meyer assessment test. Basically, this showed that the most improvement was found after 6 months when the patients were reevaluated. The patients were evaluated with these outcome measures in the beginning, before the study happened, completely right after the study happened, and then 6 months post the study. It was found that there was not statistically significant. Our p-value was 0.05. I found that interesting because a lot of people had it, like the patient outcome measures were very good, saying that they felt a lot of improvement, but overall the improvement was much smaller than it seemed. Conclusions and clinical applications. The conclusions of the authors basically said that the CFFES treatment had an overall better functionality effects towards patients in comparison to the CNMES treatment. With using ESTEM, I think that it's effective at reaching stroke patients to move and increase grip again, but it's not statistically significant. So in our clinic, I don't find, or I feel like we would not use it as often since we are not working with stroke patients. The critiques and future studies. I feel that the study was good and solid, but I think that based off of what I had read, it should have been fully blinded to the patients on what was happening to avoid biased results. Because the patients did it at home, it was randomized, but they eventually needed to know what they were doing so they could hook up their eSTEM on their own. I feel like that could be biased just because they know what they're doing and they know that either they're increasing their range of motion in their grip or they're just contracting back and forth. And so that was kind of a red flag in my opinion. I think adding a placebo group to better determine if eSTEM as a whole works would be a great idea for this study, to determine whether just exercise is going to help them increase feeling and range of motion, or if the eSTEM is actually working. And I noticed that using patients that had more recent strokes in the study had the better results. So I think focusing on patients who actually experience strokes in the last 2 years would also be very beneficial. That way, if they focused on those patients, everybody would have a better outcome. Thank you.